PSYC 379 Final Exam Newest 2026-2027 Actual Exam with complete 150 questions and correct detailed answers verified. Question 1. PG1. PSYC 379 Final Exam Newest 2026-2027 Actual Exam with complete 150 questions and correct detailed answers verified. Answers. Already graded A+. Which of the following is not summarized by Rogers, 2016, as the basic elements common to many legal standard of insanity? A. Motivation. B. Unable to confirm conduct. C. Cannot appreciate wrongfulness, nature and quality of behavior. D. Suffering from irresistible impulse. A. Question 2. In order to evaluate an individual as NCRMD, a requirement of what is necessary? A. Multiple evaluations for mental illness. B. Causal nexus between the person's symptoms of mental disorder at the time of the offense and their inability to appreciate the quality of their act, or that it was wrong. C. Evaluation that the individual had a profound mental illness at the time of the offense. PG2. D. All of the above. B. Question 3. Statistics Canada, 2014, reported that less than how many cases nationally are NCRMD cases? A. 15%. B. 25%. C. 1%. D. 0.5%. C. Question 4. Which diagnosis is most common among NCRMD patients? A. Mood disorders. B. Borderline personality disorder. C. Antisocial personality disorder. D. Psychotic disorders. D. Question 5. Rogers, 2016, highlights which approach to NCRMD that can lead to confirmation bias in reviewing evidence? A. Linear best fit model. B. Motivation facilitation mode. C. Hypothesis testing. PG3. D. Both A and C. Question 6. Rogers, 2016, linear best fit model argues. A. Taking a data-first approach and seeing how well the data fits with insanity standard makes it less susceptible to bias. B. Taking a hypothesis-first approach will ensure a more accurate assessment. C. Clinicians must develop a hypothesis prior to collecting data to determine the likely cause of the person's offense. D. By creating a hypothesis, then interviewing, testing, reviewing records, you are more likely to get more accurate information. A. Question 7. Malingering is A. A client having more than one mental disorder. B. A client exaggerating mental illness for a lighter sentence. C. A client helping the prosecution. D. None of the above. B. Question 8. Which of the following does not align with Rogers, 2016, S reasons as to why a defendant does not perceive the wrongfulness of their actions? PG4. A. They suffer from delusions or disordered perceptions that they/others were in grave dangers. B. They believed they were defending themselves/others. C. They believed they had to the legal or moral authority to do what they did. D. They had secondary gain. D. Question 9. Which factor does not predict radivid for NCRM patients? A. Number of past convictions. B. Number of past NCRMD findings. C. Age. D. Comorbid personality disorder and substance use disorder. C. Question 10. Which static factors are not found to decrease likelihood of conditional and/or absolute discharge for NCRMD individuals? A. Male. B. Psychiatric history pre-index offense. C. More severe index offense. D. Less severe index offense. D.